My name is Dr. Laura Perkel, and I work in Rochester, Minnesota as a chiropractor. Periodically, there are conditions that we see that we have to treat around or evaluate for or refer for. One of these conditions is called a spinal fusion. Several of my patients, after having previous disc injuries, have come in with spinal fusion as a result of a herniation that was so severe and extensive it was causing extreme referral bilaterally, extreme spasm locally, and an awful lot of pain. It may have even impacted the control habits of bowel and bladder. These particular problems were severe enough that they were a surgical necessity. In these cases, often the entire disc is removed and one bone is glued to or stuck to the very next adjacent bone. What I have found in patients with spinal fusions, or two bones that are glued directly together with no cushion between, is that the adjacent segments above and below that spinal fusion need an awful lot of extra care. If every bone in the spine is supposed to do a job, and we've just eliminated one, the one directly above and below tend to work a little harder than they should. It's just like when you go to work and 3 people were supposed to show up, only 2 did, now those 2 have to work harder. So what I found is you take care of those 2 employees. Take care of that segment above and segment below that fusion. Make sure that we're not spreading into different regions for compensation reasons. Spinal fusion is quite a common thing. I treat around it frequently, and it sometimes is the only thing that we can do for a severe spinal herniation. If you have any questions about your spinal fusion or how it can be treated safely with chiropractic care, visit chironerd.com.